afternoon, and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my co-host, Dr. Loreena Ryder. We're here to help navigate your journey to wellness. We like to do it simply without all of that horrible, confusing medical terminology that everybody hates. We're here to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, you can come see us at Naturopathic Physicians Group to help get your life back.
Dr. Ryder here with topic of the day. We're talking about neuropathy, more specifically peripheral neuropathy. So let's make sure everybody knows what neuropathy is. This occurs when a nerve in our body is damaged in the body's extremities, and the residual effects occur from that damaged nerve. The most common place in our bodies is the arms and hands or legs and feet. Peripheral is just meaning our most distant parts from our center body, so our extremities. So we're going to focus on peripheral neuropathy today.
They say that as many as 10% of all people over the age of 50 will have some form of peripheral neuropathy. So if you are 50 and you don't have this, consider yourself lucky. There's a 10% chance that, or I can say 1 out of 10 chance that somebody you know near you is going to have that. So very common, as many as 20 million people living in the United States right now has this.
There are different types of nerves that can be affected with neuropathy. Your motor nerves, which are muscle-controlled movements. Patients that have these nerves damaged will have trouble with certain movement that the damaged nerve controls. There's also autonomic nerves, and autonomic and regulatory nerves control things such as blood pressure, breathing, bladder function. These are things that we cannot control on our own. We can, but it's basically automatic to an extent. So this is less common with peripheral neuropathy, but still possible. Patients that have these nerves damaged will have more problems regulating these automatic functions like blood pressure. So their blood pressure can be uncontrolled. Their breathing might be sporadic or difficult. Even digestion can be affected, and that incontinence, difficulty holding your urine, heat and cold intolerances, and sweating issues, etc.
And as we age, we tend to get less strong. That's not a good thing. As we age, our ability to control these autonomic nerves become less for a lot of people, hence why over 50, 1 out of 10 will have some form of peripheral neuropathy. But if you talk about neuropathy as a whole, it's a much higher percentage than that. That's when people end up getting incontinence, needing Depends diapers as they age, etc.
There's also sensory nerves that can be affected with neuropathy, and these are nerves that control pain and itchiness and temperature changes in touch, and patients with this can have pain in the area of the damaged nerves and all of the other symptoms of peripheral neuropathy.
Yeah, pain is the number one reason why they will show up to the office with peripheral neuropathy. Numbness is a common symptom as well, and even some tingling, but it's when it starts to hurt them, that's usually when they show up to the doctor. They will have moments where they're like, I just feel like I'm numb, and they'll show up to the doctor, but oftentimes they'll be like, oh, I'm aging. I hear this can happen. But then when they start to hurt, that's when the panic button starts to set off. And that's when they're like, all right, I need to get this checked out.
And this can be like a burning pain, stabbing, or even a shooting pain. But it can be any or all of the above. And due to the nature of the pain, of the tingling and numbness feeling, it can affect your gait and your coordination, your ability to walk, your ability to hold things if it's in your hands. And that will also be concerning and bring you into the doctor's office. And there can be weakness as well. Yeah,
with the weakness, we'll have people say that when they're holding their coffee mug, they'll misjudge because of the weakness. They'll drop their coffee cup, or walking, they'll be like, I have some numbness on part of my foot. So when they're walking, they're changing the way they walk to not walk on that numb part. So then they end up throwing the rest of their body off and causing pain. So it's definitely something that you want to get addressed when it happens. But you'll have sensitivity to touch, both whether you're touching something or someone touches you can be a symptom of that. But some people say they always feel like they're being touched. And that's another symptom, and not in a good way. This is in the bad way. They feel like they'll say, I feel like there's somebody constantly grabbing my arm, or I feel like somebody's constantly stepping on my foot. These are the things people will complain about. And some of the times, like you're not even wearing a sock or you're not even wearing a glove, but you'll feel like you're wearing a sock or a glove at all times.
Yeah, and so if you are experiencing those things or the uncontrolled blood pressure, profuse sweating, or heat and cold tolerances, but more heat, get into your doctor and get evaluated and see what's going on there. Now, there are 5 stages of neuropathy. So there's numbness and pain. Then there are also regular and persistent symptoms. If this just happens once, I don't know, maybe a fluke. But if this is persistent, there's definitely a problem. If it's debilitating pain and unbearable tingling, you're moving along those stages. And then there could be a progression to constant numbness. And then the final stage would be a complete loss of feeling. And there's no pain, just intense numbness due to the damaged nerves. And that's the last stage.
And this is, when you get to that point, it can be really dangerous, because if you're not feeling anything in your lower extremity or your upper extremities, what happens if you have an infection in the bottom of your foot, or you have an infection at a fingernail, something that sounds pretty benign but can turn into a problem? If you have an infection but you have no feeling, you're not feeling the swelling or the pain associated with that infection, people tend to ignore it then, and those infections can turn into septic infections. So it's very serious when you get to the point where you're feeling nothing at that moment.
Let's talk about some causes for peripheral neuropathy. So this can come from a trauma or an injury, such as a car accident. It can come from old age, I guess, wear and tear as we age, previous sports injuries in our younger years. But the most common cause, this is the most common cause other than diabetes, and diabetic neuropathy is actually the most common. Nearly half of diabetics will have some form of peripheral neuropathy.
And just from a personal standpoint, I was rear-ended in a car accident, 13 months ago. And right after the accident, I started having some numbness in my right hand, which, as anybody who's been in my office knows, I do a lot of injection therapies. And of course, I use my right hand, being right hand dominant. So I was having no issues when I was doing the injections. That was fine. But when I would take the needle out and have to go put the needle into the sharps container, my hand wouldn't open up to put the needle in the sharps container. I would have to physically pay attention and open up my fingers at times. And it was freaky. It's scary because, again, this is what I do for a living. So when I started treating it, and now it hasn't been an issue in many months at this point, but it just shows you how debilitating something like that can be. And it also shows you that we're human as well.
Yeah, I forgot about that you...
Yeah, it was never a problem going in doing the injections. It was when I was done and having to put the needle in the sharps, my hand would lock up and I wouldn't be able to open my hand to throw the needle away.
Yeah, I know you had to do it with your other hand.
But the treatments worked.
Yeah.
We treated it and it's better.
Thanks for tuning in to Your Health is Wealth. We are the doctors from Naturopathic Physicians Group located in Scottsdale, Arizona. We discuss a different topic about natural remedies for your health every week, and today's topic is neuropathy.
Every single week I do a segment called What Isn't Your Doctor Telling You? This isn't an anti-doctor segment. This is just a segment where I like to give a tidbit that likely was never said to you by your primary care doctor or your specialist doctor when he's prescribing those pills that he wants you to take for the rest of your life. So I like to give a tidbit that may or may not help you that doesn't involve any drugs. So today, since we're talking about neuropathy, I figured I would be the mean one in the room and say, coffee. Don't take away my coffee. But if you have neuropathy and your doctor never told you that coffee and caffeine can make your neuropathy worse, something you should probably think about and something you should know. Consuming high amounts of coffee or caffeine will cause those blood vessels to tighten, which will then decrease the blood flow to those extremities. When you have less blood flow to those extremities, it means you have less oxygen to those extremities, which will then affect those nerves down the arms and the legs. So, on that note, that will increase your sensations or your non-sensations if you have peripheral neuropathy. So if you already have neuropathy and you're drinking coffee, just remember that caffeine is irritating it and it will make you feel worse. The more you drink of it, the higher the risk, because that's a question everybody likes to ask. Well, can I have 1 cup, 2 cups? I'm not a conscience. I'm not going to sit on your shoulder and tell you. The truth of the matter is, if you know the information, you can make your own adult decisions in that process.
Said.
Thanks.
Let's go back to some other causes of neuropathy. So some cancer and chemotherapy drugs. This is actually pretty common if you're a post-cancer survivor and you've had the chemotherapy treatments. A lot of people will report neuropathy. Being overweight or obese is a risk factor. Metabolic syndrome, and those are the three things that make up metabolic syndrome are high blood pressure, high cholesterol, high blood sugar, and the overconsumption of food in general. Specific processed carb-rich foods you'll be at a higher chance to develop neuropathy as well.
Again, food that's inflammatory is going to affect every aspect of your body, including the neuropathy. So again, if you don't exercise, you're not getting enough oxygen to those muscles. It's going to increase your symptoms. People with autoimmune diseases. There's a lot of different autoimmune diseases that deal with pain and a lot of them that deal with neuropathy. Lupus can do that. Sjogren's, rheumatoid arthritis, Guillain-Barré syndrome, all of these things are linked to having damaged nerves and neuropathy.
And even infections such as Lyme disease, shingles, Epstein-Barr virus, and HIV can lead you down the road to neuropathy. Having tumors, either cancerous or benign, that are large enough growing to near a nerve to affect the nerve, that can be a cause of neuropathy. And a big one that nobody really likes to hear is alcohol, because this depletes your B vitamins and damages nerve function. It also slows the brain activity, which can cause nerve issues as well.
When I used to drink, not a lot, but it definitely made my brain slower. It's not good, though. I liked my brain. I should say I like my brain. I shouldn't say I liked my brain, because that would be past tense. But yes, alcohol. So we've now taken away coffee, sugar, and alcohol, and we're only 20 minutes into the program, so we probably don't have anybody listening anymore. That being said, heavy metal toxicity, we've done whole shows on just heavy metal toxicity, but lead, mercury, and aluminum all are linked to damaging nerves, and especially mercury and aluminum. Those two are very much central nervous system damagers, and therefore your whole nervous system is going to be affected with that.
Cold weather. We don't have to worry about this too much here in Arizona, but it doesn't cause neuropathy, but it definitely slows your blood flow within your body, which can make the neuropathy worse. So we probably hit cold weather January-ish. You might have 4 weeks of it.
I'm cold in August, but that's just me. So cold weather is very subjective. So if I had neuropathy, I'd be screwed from August, probably like March to August.
Oh my gosh.
Stress. I should say August to March.
Yeah, other way around. Stress can increase inflammation and decrease oxygen output to the body as well, and this will cause less blood flow, just like being cold, to the periphery, and that will increase those neuropathy sensations.
So when you go to your doctor when you're having numbness or tingling or you're having some kind of peripheral pain, what are they going to do? Your primary care sometimes will run some normal blood work, or they might refer you to a neurologist to get a full neurological exam. That's going to be the number one thing you're going to probably have done when you see your doctor with this. They're going to evaluate your movement, your muscle strength, your coordination, your balance, your vision, test all your senses, your vibrations, your sensitivity to touch, temperature, pain. All of these things can be done through a full neurological exam, because that can give you some really good information on whether or not they're thinking it's due to a nerve issue. But the blood work is also something that's very important to run, and we'll get to that in a minute.
There might be an imaging asked for, an MRI, because if they're thinking maybe you have a space occupying lesion somewhere that could be possibly pressing on a nerve, they want to rule that out. They might also do a nerve conduction study where they're going to test your nerves to make sure that they're feeling the electrical impulses and make sure they're getting transmitted back to your brain, and that system is working great. They might order an electromyogram that evaluates the nerves and the muscles working together to make sure that pathway is working. So whenever you go to your neurologist or your primary care doctor, they're going to start checking things off the list to try to determine the direct cause of the issue, or at least that's the hope.
Yeah, and your primary care will likely run basic blood work because, as we said earlier, diabetes is such a common connection to peripheral neuropathy. Heart disease is a common connection to peripheral neuropathy. So they're going to want to run those basic labs to make sure that's all in check. They're going to run your fasting insulin. Insulin lowers your blood sugar. They're going to run your hemoglobin A1C. Or at least when I say they're going to run, they should run your hemoglobin A1C because that's your true diabetes marker to determine if that's an issue. Because again, a very high percentage of people with diabetes will develop some form of neuropathy. They're going to run your CMP, comprehensive metabolic panel, where they can check your kidneys, they can check your blood sugar levels, they can check your liver enzymes, they can check your electrolytes because low electrolytes can also be linked to nerve system issues as well. So these are all very basic things that if your doctor has a problem ordering and you're having these symptoms, you need to find someone who's not afraid to actually look at detail.
Mm-hmm. And hopefully they would run nutrient deficiency panel because B vitamins are big causes of neuropathy. But if they don't, a naturopathic doctor definitely would be checking your nutrients. So let's talk about some traditional treatments that if you go to the traditional doc, what they are going to be doing if they decide that neuropathy is your diagnosis, you will likely be given something called Gabapentin or Lyrica. Yeah. So the pregabalin. This is used for headaches, epilepsy, fibromyalgia, anxiety. They are anti-nerve medications. So they do decrease the nerve sensation, and that can relieve the neuropathy. Doesn't always, but that's probably the first line therapy of what's going to be given to you by a conventional doctor.
And long-term use of these being a GABA-type drug, long-term use of these are linked to depression-type symptoms, for some people, anxiety. And again, I've seen this prescribed to a lot of patients when they don't even know what's going on with the patient. They're just like, these other things aren't working, so let's try gabapentin, and then they're just given that. And again, these aren't always easy to get off of because even if the problem wasn't a nerve issue, when you start playing with the nerves with these drugs that block nerve sensation, when you come off of the drugs, you're now going to feel nerve sensations. So they'll actually create the problem you were not even knowing you had. So it's sad sometimes. Antidepressants like amitriptyline, Cymbalta, these drugs they use because they also are known to decrease nerve sensations by calming down those overactive nerves. But again, they're not treating the cause of why you have it. These are all masked Band-Aids for short-term relief.
Opiates like hydrocodone or oxycodone can also be used. They are highly addictive if you didn't already know that, and they're extreme painkillers. There are side effects that can be extreme constipation and depression, and one of the leading causes of deaths in this country. So before you agree to an opiate, or if you don't know what you are having prescribed by a doctor, look into it. You have the right to ask for something as an alternative.
And this drug used to be handed out like candy. It's watched a lot closer now, as should be. But they used to give this to people. I worked in a pharmacy for 7 years. We had opiates on our fast mover shelves. They were flying off the shelf, as was gabapentin, as was a lot of other medications for pain. So this is a highly prescribed drug. And what would happen is when they had the opiate crisis, all of a sudden the doctors were afraid to prescribe it. So they were just telling their patients, we can't do this anymore. They're addicted to the drug, and then they're told they can't get it anymore. So it became a major problem, and the patients were the ones that suffered. They never started on the drug until the doctor prescribed it, and then the patients were the ones that had to suffer because of it. I'm not advocating get them back on the opiates, of course not. But the truth of the matter is it just shows you how, these medications can be really dangerous. So thank you for joining us on Your Health as well. Well, we're the hosts, and we work at Naturopathic Physicians Group if you ever need a good doctor. Today we are talking about neuropathy.
Dr. Ryder here with your tip of the week. I'd like to talk to you about B-complex today. So you can actually develop an imbalance of B vitamins if you are taking only one or two types of the many types of B vitamins. For instance, if you're only taking B12 to combat neuropathy, you should also be taking a B complex to balance your B vitamins. B12 and folate, which is B9, work together. Folate depends on B12 for absorption and other metabolism, and other B vitamins depend on each other too. B1 helps the absorption of B2, and B5 helps the body use B2. B vitamins also interact with a ton of other nutrients like calcium and iron and zinc, but bottom line, if you are supplementing with a single B vitamin for whatever reason you might be, that's okay, but it should also be accompanied with a B complex.
And then you can behave. No, in general, yes, 100% agree. There's a lot of times I will talk with patients that come in on just B12. It's probably the most common one. They'll come in as a solo, and I'm like, we need to up our game here. And it's you'll get more energy doing it, correctly than doing it as a single. The reason why people get so much energy from B12 is because in the pathways of your brain chemistry, B12 is found right before adrenaline. So it gives you an adrenaline spike when you take it. But it's not that different of an adrenaline spike than even doing some caffeine for some people. Not everybody, some people. So sometimes it's a very expensive cup of coffee, which, by the way, a cup of coffee is still not good for neuropathy. So you're talking about the medications the conventional doctors use, and one of the most common ones people will use is anti-inflammatories. This tends to be the first-line therapy most conventional doctors will tell you to do. They'll be like, you're in pain, go take some ibuprofen, go take some aspirin, go take some diclofenac, or if you need a prescription, here's Celebrex. So they love to throw the anti-inflammatories out there and ignore that long-term anti-inflammatories are very problematic in your system.
Also, if neuropathy is the result of heavy alcohol drinking, you probably have passed the point of just stopping on your own. So an alcohol recovery center might be recommended to you to help that recovery, find a facility, find a group, something like that to get you back on the straight path, and then work on the neuropathy while you're doing that. And also conventional docs might recommend compression socks. These socks apply pressure to your feet and try to get that blood flow going in the correct direction and may be able to reduce some neuropathy symptoms.
Yeah, and back on the alcohol recovery center, this is always looked upon as a negative by so many people, or they'll say, I don't have the time for this. But I assure you, if you are at the point to where alcohol is creating this problem, you need to make the time for this, because if you think the neuropathy is the only thing coming, you got a lot of other problems that are tiptoeing their way towards you, and it doesn't get better until that's fixed. So again, we're not trying to say you need to take 90 days of your life to try and get 100% clean, but if you're at this point, you need to take 90 days of your life to get clean. You don't want to sugarcoat this, because I hate to tell you, it's a walking off the cliff kind of thing. You start walking towards the cliff, it's getting worse and worse. One day you're going to fall off that cliff, and then there's no turning back.
Let's go into some naturopathic testing. If you have neuropathy and you go to a naturopathic doctor, we're going to do some of the conventional doctor testing. However, we'll do a few things different. So we will also assess for nerve damage in the nerve root area, any radiation, neck, shoulder, elbow, wrist, low back, ankles, feet, all of that. And we may even refer out to a neurologist for second opinion, some more specialized testing and that type of thing. One of the main tests that we will do as a naturopathic doctor is a food panel.
I don't think we've ever said that
Yeah,
before.
that's new.
This week we have not talked about it yet.
We'll assess foods that could be contributing to conditions such as diabetes, autoimmune, and neuropathy. And the three top foods that we see come back on almost every person's panel, which are inflammatory triggers, are gluten, dairy, and eggs, unfortunately. And then sugars probably hanging in there at the end. It comes back showing up as candida, but that's sugar.
Yeah, candida feeds on the sugar.
Yeah.
But again, food, I've said that I think once or twice before, but ultimately treat the cause. If your cause is due to an autoimmune disease, if it's caused by diabetes, you have to treat that. It's not just going to magically go away. And if you don't treat the cause, you don't get better. Same thing applies with heavy metal testing. As we talked about earlier in the show, if lead, if mercury, if aluminum are all linked to nerve damage, if you have those in your body, you have to remove those. It's not that cures the neuropathy, but it stops the damage from happening because of the mercury or the lead, which then allows your system to start the healing process. So you got to remove that stuff. And again, if you were born before 1978, which isn't that long ago, lead was found in everything practically before then. So you grew up in a house painted before 1978. You grew up in a lead painted house. It's still in your system if you don't remove it.
Let's talk about some naturopathic treatment options now. This is the fun stuff. So obviously we are going to talk to you about diet and lifestyle. If you are overweight, we are going to help you come up with ways that you can lose weight. The more ways that you lose, the more weight that you lose when you're obese, the less pressure and compression occurs on the structures, and that can help decrease the neuropathy and the damage if it's caused by the compression. Gravity, we all know what gravity is. It's just harder on the nerves and creates more pinching and inflammation. And we would also address the food. If we did that test, which we encourage, you would avoid your food allergens. Just remember that 80% of your immune system and a lot of the inflammation is coming from what we eat. And if we reduce that inflammation, our joint pain will go down, our nerve damage will decrease, and we will just feel better overall.
And I see this a lot, and I try to be that optimist in the office, especially with patients. But when someone like loses 25 pounds and they need to lose 75, oftentimes they get discouraged because they feel like they're not losing the weight fast enough. And so then they're more likely to jump ship than keep pushing along and get better and better. Because a lot of times they would be like, I've lost 25 pounds. Why do I not feel better yet? It's because you needed to lose 75. That doesn't mean be discouraged about the 25. Celebrate that lost 25, but keep pushing through, because oftentimes when you get to that goal, that's when the symptoms start to improve at that particular point.
And because we are naturopathic doctors, we like to treat the cause. That's what we do. So if you are diabetic, we will be treating the diabetes. We will be getting to the cause of where that came from. If you are a smoker, easier said than done, stop smoking, but we can help you with that as well. And water, it's just a fundamental essential of life. Water increases oxygen output to your nerves, improves blood flow, and studies have shown that it decreases neuropathy symptoms. Drink about half of your ideal body weight in ounces if you have healthy kidney function that can handle that.
It's funny how often we talk about water too, and yet almost every patient I talk to says either they drink too much or not enough. And there's not a lot of in between. It's I drink a gallon a day, or it's I drink less than a bottle, and that one bottle I drink has some fake flavor in there because that's the only way they'll drink the water. Mm-hmm. It is so important to make sure you are hydrated for all conditions. And water is good topically as well. If you do a warm bath with essential oils like lavender or frankincense, these can help alleviate those nerves. And as you said earlier, exercise. Exercise plays a huge role when it comes to muscle integrity, muscle strength, and it's so important to keep that oxygen flowing, which is beneficial for your neuropathy.
Yeah, and if you're one of those people who absolutely despises drinking water, there's tricks. But you can also increase your water-dense foods like cucumbers, watermelon, that kind of thing. That can be a little trick as well. So if you feel like you're just not getting to the bottom of your health issues with your current doctor, give us a call at Naturopathic Physicians Group. We're in Scottsdale, Arizona.
So we're going to jump right into naturopathic treatments. That's our favorite thing to do, as we are naturopathic medical doctors. With neuropathy, we have a lot of things that we do for this, and the goal is trying to figure out what's right for you, because again, we treat every patient as an individual. So when we are talking about procedures, when we are talking about IV therapy, when we are talking about supplements that we use, again, we treat every patient as an individual. So these are things we have used for people in the past, but that does not mean it's right for you. We tell everybody that we are not telling you to start or stop any treatments out there. We are just saying these are what we've used before, and if you want to know what would be right for you, you can come see us at the office of Naturopathic Physicians Group. So on that note, procedures. We love IV therapies for neuropathy. so many people with neuropathy have digestive issues or diabetes, and so they have problems with their digestion. You're not going to absorb nutrients at a high rate by mouth. So we can bypass oh my God.
Bye-bye.
We can bypass that by doing IV therapy. So the ability to heal damaged nerves through IV therapy is astronomically higher than just using supplementation. So one of the ones we use is a neurological IV. Neurological IVs are going to be individually based because we want to help people with B vitamins, vitamin C. We want to help people with the nutrients that they're lacking in order to help repair those damaged nerves.
Alpha lipoic acid IV infusion is amazing. I've had some really great success stories with using this IV in relation to neuropathy. Alpha lipoic acid also lowers your blood sugar, as well as helping reduce the peripheral neuropathy. Now, yes, you can take ALA or alpha lipoic acid in a supplement form, but you never get as high of dose as you could possibly get in an IV form.
Chelation means metal binding. This is the heavy metal detox. So again, when we do heavy metal testing in the office, we find out if those heavy metals are causing part of the problem. Again, treat the cause. We can remove those heavy metals from your system with treatment, and again, can be a game changer for a lot of people with neuropathy.
This is one of my favorite IVs. I love finding heavy metals because almost everybody has them after just living here on Earth.
And these are one of the ones where a lot of people have no idea what these are, and it could be the missing link to helping them heal.
Mm-hmm. Another great IV is called phosphatidylcholine. This helps protect the neurons and the nerves by insulating and protecting the nerves. And it can help and heal, improve nerve damage. And this is also really great for the brain as well. It's shortened as PPC, but it's phosphatidylcholine.
Now, what if it's the nerve is getting pinched because of a joint issue, or if it's getting pinched because of weak tendons and ligaments? Again, treat the cause. Doing drugs for that is not going to help treat why the nerve is being pinched. So at that point, we do the treatments in the office called prolotherapy and PRP, which stands for platelet-rich plasma therapy. These are people with chronic pain issues. These treatments are amazing. They're the opposite of the steroids that you get from your conventional doctors. These are going to get to the root cause and start to heal those damaged tendons, heal the damaged ligaments, strengthen and heal those damaged joints so you're no longer pinching on the nerves. And again, chronic pain, this is probably the number one thing I do in the office are these treatments because they're so effective at treating pain.
Now, when you were talking about your finger locking up, not being able to open it, this is what you were doing.
Yeah, we did PRP in the office. After the first treatment, I was having that lockup probably decrease by about 75%. And by the third treatment, it was not happening anymore and has not happened since.
Yeah, so for people who are terrified of needles, we have something called focused shockwave therapy. So this is trying to mimic the pathway of PRP and prolotherapy by inducing inflammatory healing, but this helps stimulate the blood flow to the nerves and helps the nerves heal. This is good for a lot of different things, including erectile dysfunction, because that has to do with nerves as well. But
it's nervy.
Yeah, it is. So focused shockwave therapy. I know it sounds a little shocky, but there are no needles involved.
And good old-fashioned. Oh my God. I think I need to retire. Now, good old-fashioned chiropractic spinal manipulation. If you're getting pinched on a nerve and you open up that nerve root, the pain can go down. Where that tends to be difficult sometimes is that if you can move things and put things back in place, what's keeping it in place so you're not just pinched on that nerve again a couple days later? That's where those prolotherapy and the PRP kicks in, because that will strengthen those tendons and ligaments. So when you get adjusted, the adjustments hold better, and now you're not having that constant pinched nerve.
Yeah, I love pairing spinal manipulation with PRP and prolo. It's really great. So let's talk about some supplements. I had talked about an alpha lipoic acid IV before. This is the alpha lipoic acid supplement. It is a nerve protector, can help relieve the damaged nerve and help with pain. And then we were talking about Gabapentin earlier as a prescription medication. GABA is actually a natural neurotransmitter, and you can get that in supplement form. And this runs the same pathways as the nerve pain drugs and many of the anxiety drugs, but GABA decreases overactive nerves that are causing pain and tingling.
So, as Dr. Ryder said earlier about all the B vitamins and why you shouldn't just do single Bs unless you have a problem where you can only handle single Bs, but B1 reduces pain and inflammation. It also gets depleted from the alcohol, so you need B1 for nerve function. B3 helps protect the nerves. B6 protects the covering around the nerve, which helps insulate and protect that nerve, which then allows the nerve to work better. B7 is good for tendons, ligaments, and joints. That's biotin. It's good for tendons, ligaments, and joints. It's neuroprotective for people with neuropathy. B12, again, helps with energy, but also helps when it comes to the tingling sensation with the nerves. So again, all the Bs can be part of the cause of neuropathy. But again, there are certain Bs that are good and there are certain Bs that are not good when it comes to quality. So that's something you have to talk with your doctor about to make sure you're doing it right.
Magnesium is fantastic. It's one of my favorite supplements. There are numerous studies that shows magnesium helps calm down the nerves and can help with neuropathy. And there are many different types of magnesium out there. So the second word after the magnesium supplement is the carrier salt. Just be careful not to go too hard on the magnesium citrate or you'll just end up with loose stools.
And if your neuropathy is due to blood sugar issues, Panax ginseng helps with increase the sensitivity to insulin. Can help lower blood sugar levels, but it's also really helpful for brain health and nervous system function. So that's one of those ones a lot of times we use not as the fixer of the neuropathy, but as an adjunctive addition to the neuropathy that can have some other benefits.
Vitamin D is one of those that most people are deficient in. You wouldn't know until you do a blood test to check it. But if you are having pain and nerve type symptoms, it could be an indication of a vitamin D deficiency.
And cayenne pepper, yeah, let's burn everything. No, cayenne pepper is actually used over the counter. They have capsaicin powder, which is using cayenne pepper to help for nerve pain, and it helps with the signaling of the pain. But you can also take cayenne pepper as supplementation, and it's found in a lot of natural products.
Melatonin is a naturally occurring hormone. It's our sleepy hormone. Studies show that melatonin reduces oxidative stress on the body and decreases inflammatory processes that lead to neuropathic damage. Basically, melatonin makes the neuropathy more tolerable. It can also help you with other things like digestion and sleep, but melatonin helps with neuropathy.
And just think of inflammation as a whole. Treat the cause. So the diet plays that role again. Get rid of heavy metals. But natural anti-inflammatories can also be beneficial for nerve health. Stuff like curcumin and fish oil. But if you're doing fish oil, again, there are so many different forms of fish oil out there. You have to be very careful. You want to make sure it's small fish, wild caught. You want to make sure that it's omega-3 based. And we definitely have used this to help people get off of painkillers before, too. It's not the same as the painkiller for pain, but as a part of the protocol, it can make a huge difference. So thank you for joining us today on Your Health is Wealth. We hope you enjoyed our episode on neuropathy, and we will see you with our next episode. And have a great week.